Welcome, everyone. This is the next in our series of free webinars hosted by Greater Therapy Centers, presented by our physical therapist. We'll be doing these every weekday through May 1st at 10 a.m. You can check our Facebook page to get the schedule. We also upload these webinars to our YouTube channel about an hour after they are completed every day. So you can go to Greater Therapy Center's YouTube channel to check those out. Today, Devin Johnson will be presenting, and I'm going to give you a bio real quick, and then I'll mute myself. Before I do that, there's a question box that you can certainly type your questions in, and we'll save questions until the end for the most part. I'll monitor those and then come back on at the end, and any questions that we can answer, we'll do that. All right, so Devin Johnson. Devin started working with Greater Therapy Centers in February of 2019. He attended the University of Texas, San Antonio, where he received his bachelor in kinesiology with an emphasis on exercise science. He then attended UT Southwestern Medical Center, where he graduated with his doctorate in physical therapy. In his free time, Devin enjoys the outdoors, watching soccer, spending time with friends, and rock climbing. So I'm going to let Devin get started here. Like I said, I mute myself, and I'll be back at the end. Go ahead, Devin. Thanks.
Hey, thanks, Brad. And thank you all for taking time to spend some time with me to talk to you guys today. As Brad said, I'm going to be going over lifting mechanics and talking a little bit about proper lifting, how to pick things up off the ground, whether that is laundry you're doing or for your job, and kind of techniques to help with your overall back health. So the objectives of today's presentation, I want y'all to be able to recognize two different methods of lifting. I'm going to kind of go into more details of those as the presentation goes on. And I want you to know, when would you do each one and how to break that into its individual components to make it a little bit less complicated, because looking at, picking something off the ground can sometimes overwhelm a lot of people, and a lot of people will tend to lift with their back. And it's always going to be important to understand, why is this important? Well, it's usually going to be important for all of us to prevent any back issues. So having said that, a lot of people, when they pick up boxes or they pick up laundry or pick up anything around the house, we always have good intentions of, hey, I'm going to squat down, pick it up. But a lot of people sometimes get overwhelmed by the idea of having to actually do a squat and actually lifting it up. So a lot of people will pick up things like this where they're really bending forwards and picking it up, or they maybe start with like a partial squat like this middle gentleman right there, and then they don't really lift with their legs. A lot of people sometimes they get into a good position, but then they actually lift with their back and not with their legs. And so I want to take some time today to tell you how to really lift properly. So why does it matter? This slide may look somewhat familiar too. I use this for my neck pain as well. But back pain is the leading cause of disability. It is the most common reason for missed work, and it also takes a somewhat burden on the healthcare system. So when you look at lifting something, when you look at this picture here on the right, you can kind of get a good idea. So we're going to say this person, the torso weighs 105 pounds, and they are leaning forwards to pick something up, which in this picture, the weight is 10 pounds. The stress on the back ends up becoming about basically multiplying both together, averagely the amount of force you start putting onto your back. And while, yes, the back is designed to take heavy loads, it's designed to take the natural wear and tear, it's the kind of the constant. So, it's not going to kill you to lift 10 pounds improperly every once in a while. But now if you start doing this on a regular basis, you get lazy, you're just like, hey, I'm just going to bend and pick it up instead of actually squatting down. That's when you can start having issues. So a lot of people will go multiple years where they're lifting things, not having any issues, and all of a sudden one day they tweak it just wrong and it causes some issues. So with the virus going on in the healthcare, we're already trying to prevent extra burden on the healthcare. Let's do our part here, lift things properly to prevent us from having to go in and go into the hospital and get some assistance. Important, you kind of want to plan things out. So you always want to think before you lift. You always want to think of the weight of the object, so making sure what you're lifting isn't too heavy. When in doubt, it's always safe, smart to ask for another person for help. Is the object you're lifting a one-person job or a two-person job? If you pick this up and you start walking, is it going to be too heavy? It's going to cause you to maybe arch your back backwards while you're walking, or as you start lifting it up, you may strain something. So always keep in mind, hey, if something feels too heavy, if I don't think I feel comfortable lifting it, it doesn't hurt to just ask somebody. A little bit of assistance can go a long way. You really want to think about where you're moving from. So what I mean with that is, are you moving an object from ground to ground in a different room? Or are you moving it from the ground to above your head? And the reason that becomes important is because if you're lifting something from the ground to maybe lifting it above your head, you may want to take some weight off because it may be too heavy. If you're moving something from ground to ground, just making sure that you're able to lift it up and put it down safely. The safest way to normally lift things is going to be from a ground to like a level surface, like a table or something like that, where you're not lifting it above it or putting it back down on the ground. And then you want to think, where does it have to go on what route you have to follow? And so what I mean with that is, if you are going into like moving something from the living room into the kitchen, or living room into maybe a kid's room, think about where you have to go. Think about how far you have to walk. Are there stairs going to be in the way? Will a dog walk in front of you? Will there be a toy in the way? And so just sort of thinking ahead instead of just, hey, I'm just going to pick this up and go and kind of hope for the best. You tend to get a little bit more issues that way. So just really plan your route ahead and make sure that the route you're going to go, the way you're going to go, is a safe area for you. So the two methods we're going to talk about is the squat method, which just tends to be the more commonly used method, as well as a lunge method to pick things up. So with this, I have like kind of step-by-step instructions, and I'm going to kind of break how to really do a squat here down in a second. So what you want to do at first, you want to go to the object and you want to get your feet about shoulder width apart. And this depends on the person. Some people like a little bit of wider stance, and that's fine. So whatever feels kind of natural to you tends to be really good. Key, what I always find the most important, and the biggest thing I always see from my patients when they try to pick things up, is they don't stand close enough to the object that they're picking up. So they may have a good squat form, they may go down great, but the object's too far away, which will then cause them to lean. So get as close as you can to the object. I try to get it kind of by your tippy toes, basically. Depending if it's something a little bit narrow, you can even like get your feet around the object. Then what you're going to do is you're going to squat and just making sure to not bend at the waist. So not leaning forwards like the top picture on the right shows there. Make sure you keep your low back flat. So the good way you can do that is to keep your core engaged. So just squeeze your tummy muscles basically. You're going to grab the object with both hands. Again, keep your core engaged, and then you're going to stand up through your legs. So a lot of people do a kind of a good job at the front half of it. They'll do a great job at bending down, getting the object, and then when they lift up, they kind of forget everything and just kind of bow from their back, ouch, instead of actually standing up. Key thing is, once you're standing is when you can start walking, and that's also when you can start moving. So you never want to twist or jerk. Those are going to cause even more loads on your back, especially when you're in a bent position or kind of in a squat. So if you're going to do any kind of movement, you want to move your legs nice and slow, and don't twist to drop something over there. So when to use? So you want to use this method when you're lifting something heavy or large, because you're going to be able to use both of your legs. And you want to, this is also a good technique when you're working with another person. So it helps you, on three, let's lift this thing, both of y'all in that squat form and lifting it up off the ground. So to break it down and sort of exercise that you can do at home to prepare yourself if you feel overwhelmed with maybe lifting something like this. The way I always do it is I start off my patients with simple sit-to-stands. So put a chair behind you, just sit down and stand back up. Do that multiple times. If it takes you a little bit longer to feel comfortable to do like 30 or 40 reps, whatever you need to personally do. Once you feel comfortable doing that, work on just tapping. So instead of sitting down, you do more of a tapping the chair and standing up. A lot of people think squats are super complicated and get overwhelmed, but if you think of it as almost sitting down onto a chair, it makes it a little bit more simple. So once you feel comfortable tapping the chair, it's time to do actual squats without a chair behind you. So I always will start off with some support. So whether that's like a stair rail or a kitchen counter or a couch, whatever you want to use, just holding on to that for some support as you do some sitting and standing. And then if you feel comfortable enough to take it away for some balance, you take it away, and then you start working on picking something light up off the ground. So you don't want to start, lifting a 60, 80 pound bag or something like that, or whatever you're lifting. You want to start off with something light, maybe like a grocery bag. That's something you don't have to per se squat, but just working on the form. Hey, I'm going to squat, get close, I'm going to pick it up, and then you can gradually improve your strength and improve your tolerance to lifting heavier things. The other one I want y'all to know about as well is going to be the lunge. So the lunge, you're going to stand next to the object in a staggered stance, and you're going to put the stronger leg in front. So it doesn't matter if it's left or right. You just want your stronger leg in the front, and again, stand as close to the object. And for this one, the object's going to be on the inside of your front leg, as it shows in the picture. You're gonna bend your back knee until it hits the ground, grab the object, and stand up, keeping your back straight. And so same thing goes in here. You never want to twist, never want to jerk, you never want to do any turning, and you want to keep your feet nice and firm on the ground and keep your core engaged, and that'll help prevent any issues. When do you use this one? So this one tends to be better for anybody who has maybe you have one strong leg, or you've had surgery or some type of injury in the past on your other leg. Tends to be a good one to use for you. It's also good for objects that aren't extremely heavy, and it's also good when you have good balance. So if you have any kind of balance issue, this one tends to be a little bit more difficult because you're a little smaller base of support versus a regular squat. For this one, the way you're going to break it down the best is going to be partial lunges at first. So I'll always start off with little lunges, just a couple degrees down. Once you feel okay with that, you're going to do a full lunge. So you're going to grab onto some type of support, again, whether that's a kitchen counter, a couch, or a stair rail, something that you can hold for some support. I kind of included this picture to give you guys a good representation of what a good lunge looks like. So you want to make sure that when you actually lunge, you're dropping the back knee down versus bending the front leg forwards. And so that tends to be the more complicated part of lunge. So when you do your partial lunges, just make sure you're really dropping your back knee instead of going forwards. Once you can do it with some assistance, start doing a full lunge, get your knee on the ground, stand up. Make sure that when you're standing up, you're not losing your balance, you're not swaying side to side. Because if you may have good form getting down, you stand back up and you start moving a little bit side to side, you're going to add a little twist, and that may just tweak your back. And again, for this one, you'll then start off with lifting something like a grocery bag or something nice and light that you can work on your form and make yourself feel comfortable before you go to something heavier. So risk factors for back injury. You want to make sure that when you lift something, you don't lift with your back bowed out. So lifting with your back bowed out is a risk factor. Keeping your core nicely engaged will help with that. No bending or reaching. This tends to be one of the #1 things that people do. So instead of getting nice and close, they'll tend to just reach far out. They'll do maybe like a partial squat and reach out and then stand up with their back. Quick jerky motions tend to cause injury because you're lifting up really quick or you're twisting one way or the other. Lack of proper rest can go a long way. So if you're moving, maybe you're moving to a new house and you're doing a lot of lifting, making sure you get proper rest. Poor nutrition can also tie in, as well as stressful work and living habits. And we've had webinars that have actually addressed all of these. So if you have any questions on how to sleep properly or some exercises you can do to help with weight loss or exercises you can do to decrease your stress, we definitely have some webinars there for you. And just a quick recap. So what I've said multiple times, and the thing I will think is the most important thing to take away, is keep the object close. If you keep the object close enough, you'll be less likely to bend. With not bending from your back, you're less likely to cause injury. If in doubt, get another person. So if you look at something that looks too daunting for you, maybe the object's too wide, and you're like, hey, I can maybe get this, I can maybe not, just get another person. The worst, you're going to burden them for like a minute, and you're going to be happy for yourself because you're not going to cause any issues. If you can, go small distances. So when people pick things up, especially when they're heavy, they tend to lean back because the object's too heavy or it's too odd to carry. So to prevent that, you can set up, not even set up, but you can have things like if you're moving from, let's say, a living room to a bedroom, maybe there's a table that you can put the object down halfway through, take a quick rest, lift it back up, and go into the bedroom. You can also like hand it off to somebody else. That's another way you can prevent yourself from having issues. Keep your back flat and core engaged. Those go nice and hand to hand. Prevent yourself from bending forwards, and just don't overthink. A lot of people will overthink squats or lunges. Just think of them as simple sit to stands for the squats, and then the lunges just really break those down into their components. Again, I had to post a picture of my dogs, of course, but if y'all have any questions, my email is there, and I think Brad also posted in the question section. That's the clinic number here. If you guys have any specific questions on, how do I properly squat, how do I do some lunges, and how do I pick things up, and we can also discuss things over telehealth that we're still on. Thank you all.
Thanks, Devin, very much. We appreciate the great information. Definitely helpful for everyone right now. And thanks for joining us, everybody. Like I said, we'll host a different webinar topic every weekday starting at 10 a.m. Check our Facebook page, Greater Therapy Center's Facebook page for the schedule. Check on YouTube if you want to follow up with any of this, and certainly reach out to us if you have any questions, need more information, or want to set up a telehealth consultation. All right, Devin, thank you so much. I'm going to go ahead and sign off, everybody.
Thank you, sir.